Hey everyone, welcome to Dento'ZEN. Today we are here with our first video on dental materials where we are going to have an overview of dental materials. Now suppose a patient comes to your clinic with tooth pain and when you look inside his mouth you can actually see a tooth with deep carious lesion which has involved pulp. So what will you do now? You cannot leave it like that. So you will remove the infected pulp and you will clean the canals. But now a space is created. So you cannot leave a space like that. So you will fill that space with a material and seal it and now your patient can go back pain free. So this type of treatment is called root canal treatment or RCT, where you have removed the infected pulp, cleaned the canals and filled it with material. So you have used some material. When you looked into his maxillary arch, you can actually see a tooth with a carious lesion which is still in the enamel or dentin. It has not reached pulp, that is why patient is not having pain yet. But if you will leave it like that, it can reach pulp and can cause pain. So what will you do now? You will remove this infected carious lesion and the space that is created, again you will fill it with some material. So this type of treatment is called dental filling or dental restoration, again which is using some material. Now when you looked into his mandibular arch again, you can see a tooth with a deep fissure. Now fissure is a place where food may get stuck and may cause caries. So you do not want that for your patient. So you can prevent caries by filling some material inside this deep fissure, and this type of treatment is called fissure sealant. So again you are using some material as a sealant. When you looked into his maxillary arch again, you saw a tooth is missing which may be affecting the chewing ability of the patient. So you do not want to have that problem for your patient. So what will you do now? You can actually make an artificial tooth in the lab and you can place it in the position of the missing tooth, which can improve the masticatory efficiency of the patient. So this type of dental treatment is called prosthesis. Now this prosthesis is also made up of some material. Now, when you looked into the anterior region, you saw a fractured maxillary central incisor. Now, a fractured tooth in the anterior region may be compromising the aesthetics, that is, appearance of the patient. You do not want your patient to look like that. So, what will you do now? You can actually build this tooth with a tooth-colored material. So, again, you have used some material. Now, when you looked into the mandibular arch again, there are some teeth were like malaligned that were not properly aligned. There may be spaces between them, which may be actually causing the speech problems to the patient. So you can actually enhance the speech of the patient by correcting these alignments, by maybe filling the gaps in these teeth or by doing some other adjustments. So you can do the speech enhancement by using some material. So we have seen that for all these treatments and many other dental treatments, we are actually using some materials, and these materials are known as dental materials. But can you use any material as dental material? No, these materials can cause problems to the tissues inside the mouth, can cause irritations. So first we need to check the quality of the material. So there are certain standards which tell us whether that dental material is of good quality, can be used inside the mouth, and once it is approved, then only we can use it. So in this video, we are going to discuss what is the classification of different dental materials, what are the different groups of materials which can be used, what are the characteristics of ideal restorative material, and then how the standardization is done for the dental materials. So let's start. Before starting, quickly subscribe to Dento'ZEN, tap on the like button and hit the bell icon so that you remain notified about new videos. So what is the ultimate goal of dentistry? When a patient comes to you, you should be able to improve his quality of life and maintain it. How can you do that? So when a patient has dental problems, like you can prevent the disease, for example, by giving the fissure sealants, you can prevent caries, you can relieve the pain by removing the infected pulp and doing RCT, you can relieve the pain, you can improve the mastication by giving a prosthesis, you can enhance the speech by correcting the malalignments, and you can improve the appearance of patient by improving the aesthetics. So by doing all this, you can actually improve the quality of life of your dental patient and you can maintain that quality of life for patient, and that makes your patient happy. So what are the different materials? How do we classify these dental materials? So based on the purpose they serve, they can be preventive materials, for example patent fissure sealants which prevent the onset of disease. For example, here they prevent caries, so those are preventive materials. They can be restorative when they replace the tooth structure, for example fillings which can be made up of amalgam fillings can be there, composites can be there, so those are restorative materials. Then auxiliary materials, materials. Auxiliary materials are those which aid in the fabrication of prosthesis. That means they help in the fabrication of prosthesis, but they are not the part of it. For example, in the lab, we may be using different gypsum products. You may be using plaster, you may be using stone, you may be using some waxes, you may be using impression materials to take the impressions. So all these materials help in the final fabrication of the processes but are not part of it. So those are auxiliary materials. Then prosthetic materials. Prosthetic materials are those which finally replaces the missing structures or missing tooth. Then appliance materials, which form some appliances for the mouth. Then biomaterials. Biomaterials can be bone grafts or tissue grafts. For example, we have some defect in the bone or the tissue of the jaws. For example, there was some tumor or some mass, we removed it and a space is created. We want to fill that space in the tissue or the bone. So the grafts, living bone or living tissue that can be placed in that defect are the biomaterials. Then finally we have therapeutic agents. Now these therapeutic agents are those which are applied locally. These are the local chemicals or medicaments which may have local therapeutic effect in that region. So that is the classification of dental materials: preventive, restorative, auxiliary, prosthetic, appliances, biomaterials and therapeutic agents. Now what are the actual substances which can be used as dental materials? Those are classified into 4 groups. So these 4 groups that you have to remember can be metals, can be ceramics, polymers, composites. So metals, ceramics, polymers, composites are the materials which can be used for all these purposes. So what should be the characteristics of an ideal restorative material? It should be biocompatible, compatible with the living tissues as in the oral environment. They should not cause any irritations, reactions. They should bond permanently to the tooth structure. They should not be able to get displaced easily. They should match the natural appearance of the tooth and other visible structures of the mouth. That means they should not compromise with the aesthetics. Then it should have properties which are similar to the tooth structure, tooth enamel, dentin. So they should be hard enough. Then they should be capable of initiating tissue repair or regeneration of the missing regions, missing tooth. So those should be the characteristics of ideal restorative material. Now, how do we know whether a material can be used as a dental material or not? There has to be some standards. So what are the standards for dental materials? These are actually the specifications by which we can actually gauge the quality of the product. That means we can tell whether that product is of good quality or not. So they identify the certain requirements for a product to be said that it is of good quality. It can be used for its function in the mouth. So how these standards are developed? So earliest standards in US were developed by National Bureau of Standards in 1919, but by 1928 this responsibility was taken by ADA. ADA is American Dental Association. Now this ADA sponsors further 2 committees. The first one is the Standards Committee for Dental Products. Now as the word says dental products, so this committee develops specifications for dental products, instruments, equipments that are used, and not for drugs and x-ray. So for drugs and x-ray we have another committee which is known as CSA, Councils for Scientific Affairs, so which deals with the responsibility of evaluation of drugs, then dental x-ray films, then tooth whitening agents, tooth cleaning agents. So when these 2 committees of ADA, they specifications, these specifications are then submitted to ANSI. Now what is ANSI? American National Standards Institute. So this institute, once it checks it and approves it, then that specification becomes a national standard. So that is how the standards are developed. So ADA has 2 committees. They give specifications to ANSI. ANSI approves it and makes it standard. Now, different manufacturers of the dental products, they can submit their product to ADA for their seal of approval. So once it checks it, it can either accept that product or it is not acceptable. So based on that, if it is accepted, a certificate is given. So ADA certification is a symbol of the safety and effectiveness. So if a product has ADA specification, we can say that product is safe and effective for dental use. Now at international level, we have 2 organizations, that is Federation Dentaire International and International Organization for Standardization, ISO. Now this ISO further has technical committees. Technical committees are further divided into subcommittees based on the specific area they deal with. Subcommittees are further subgrouped into working groups based on the specific product they deal with. For example, Technical Committee 106, which is for dentistry, It has subcommittee 1 and working group 7, which covers the dental amalgam and mercury. So ISO is a non-government organization. 80 countries are part of it, and they develop specifications for international level. So there are two things: ADA, that is American Dental Association, and ISO. So that is how standards are developed for dental materials, and that is the brief overview of dental materials. So that is all for this video. In next video we are going to talk about the properties of dental materials, so don't forget to watch that video. So that is all. If you really enjoyed the video, do tap on the like button and share this video with your friends. Keep watching, keep learning, keep smiling. See you in the next video soon. Till then, take care. Bye bye.